Hello and welcome to Embracing Senior Health, sponsored by Embrace Hospice. I'm your host, Candace Howell, and today we're going to focus on Alzheimer's and dementia, and I am joined by Charlene Hope. I also have Adele Stanley and Patty Fink. Thank you, ladies, so much for joining us. This is a really sensitive issue for a lot of people, and we're going to really dial it in today, and we're going to talk about the difference between the two, because there are some distinct differences there, but also how to deal with this when we have a loved one in this situation. So if you could, ladies, tell us first, what is dementia?
Well, I can help with that one. Dementia just means that you're not thinking correctly. It's not a diagnosis, it's not a disease. It's just most of the time when people take their loved one to a physician, they already know that they're not thinking correctly. So we really need to find out what the diagnosis is.
And so what are some of the signs that we know when they're not thinking correctly? We can see it, and it becomes kind of glaringly obvious.
It does. They may not remember what you told them 5 minutes ago or even 2 minutes ago, but they can remember what happened 50 years ago. That's one of the first things that you start seeing, is that they don't remember somebody just came to visit them, walked out the door, and then they don't remember it, and they say, I wonder when they're coming to visit. And you start going, they were just here.
Exactly. And so, Patty, should we be worried when we go to the mall and we know of somebody who parks their car and then they come out and all of a sudden they have no idea where they parked that car? Because I know that I do that now. So, you know, later in life, I know I'm definitely going to do this. And this is something that's a serious concern for all of us. I mean, I know that I'm 110% on all the time now. My mind is not going to be so sharp years from now. So should we be worried about situations where we can't find our car?
Absolutely. You should be. And some of the signs that we need to look for as caregivers is that a safe thing for them to be doing? Sometimes they'll call and say, I don't know where I am. Come get me. I don't know where I am. And it's a frightening thing for them, and it's a frightening thing for our caregivers. So at that point, as Adele said, we need to start looking about signs. What do we do? How do we help them to keep safe? Whether it's a med alert or you know, an address type of bracelet that they have on them, and start looking for those signs and maybe start pulling back and helping them learn what situations not to get themselves into, and make sure we know where they are, and maybe have a caregiver with them. So that is a very, very good concern. And
then Charlene, too, let's really separate Alzheimer's from dementia. Main difference there.
Well, Alzheimer's is an actual diagnosis, where they're diagnosed that this is the disease and why it is happening, and they can pinpoint what exactly it is. And they need to have diagnostic tests done, whether it's an MRI or a CAT scan of the brain, good history and physical. It's just not by what the patient is doing or the person is doing. So they really need a physician, because there's very many different kinds, whether it's due to vascular, stroke, Parkinson's. So it's very important that they get to a physician and get exactly what's the cause of it, so that they can get treated.
Well, let's go there now. So now we're at the point where we've taken someone to the physician, or we're at the physician. What is the physician going to do? What are the next steps there to determine what we're really looking at?
What I would say too is, a lot of people look at me and go, Adele, what difference does it make? Dementia is dementia. But it does matter, because there are dementias that are reversible and dementias that are irreversible. If you have a thyroid problem, that's reversible. If medications, I had a lady one time that the doctor told them, the family, that she had Alzheimer's and she needed to be placed in a facility. She came and was placed in the facility that I was at, and I looked at my nurse and I said, there's no way that's dementia, or that's Alzheimer's. It was dementia, but it wasn't Alzheimer's. Got her into a really good geriatric physician that knew what to do. Found out she wasn't taking a lot of medications, but she was taking some. And so they were interacting with each other. That lady left the facility, went home, and stayed by herself for 7 years. It's very, very important to find out what type of dementia you have, and not just go, dementia is dementia.
And there is a root cause.
Yes.
And that's what we're
Yes.
trying to say here is that, you know, if you do go to the right person, and you mentioned something very important there. You said geriatric
Yes.
doctor, and there's a difference there, folks. You need to be going to a specialist. And I think that's something that, you know, we all get attached to our primary care physician, but we get at a certain point in our life where we need to start to look at specialists, and this is exactly an important reason why. Well, we've got much more coming up after the break, folks. We're going to be talking some more about dementia. You are watching Embracing Senior Health, and stay with us because you want to hear what's happening with this conversation. We'll be right back.
If your doctor refers you to a hospice program, you may continue to keep him or her as the primary care physician. Many hospices ask you to take their medical director, but you do not need to do this. Your doctor can be your doctor through your hospice journey. Many people think that because you've been referred to a hospice services, that you cannot remain in your home and need to go to a facility. That is not true. Your end-of-life care can be provided by your hospice team in your home where you're most comfortable.
Welcome back to Embracing Senior Health by Embrace Hospice. I'm your host, Candace Howell, and I've got some great guests here with me today. And we're talking about dementia. Ladies, once again, thank you for joining us. This is a very scary and dangerous point in our life when we get to this stage where we're looking at dementia and Alzheimer's. Let's start out a little bit about signs and symptoms, things that we need to look for to know that our loved one may be going into this period in their life.
Okay, you want to look for, do they know, they're at home? Sometimes they just forget that they're even at home. They may think because it's cold in the house, it's now cold outside. We've reversed their thinking because when they were younger, the house was hot, so hot during the summertime that you had to go outside and sit on the front porch or under the shade tree. And during the wintertime, there was only one room in their house where they were warm because that was where the heat was. The rest of the house was really cold. And now we've reversed it on them. During the summer, they're cold, and during the winter, they're warm all over the house. So they may get the seasons mixed up. And so you look at some of those things.
Well, and I know that we were talking before too, and it's not uncommon to see someone that is facing these things wear a winter coat in the summertime, and that's an indicator.
Absolutely. And they think that, we think that they've totally lost it, but they haven't. They still know, but we've confused them by making the house cold during the summer.
And we were talking too during the break, some of the dangers. So Patty, some of the dangers, let's talk about that a little bit. Sometimes folks with dementia and Alzheimer's have bracelets and things that have some really important information on them that may actually make them a target.
And seniors, unfortunately, are a target for people that want to take advantage of them, so you have to be very careful with that as well. A caregiver that recognizes that their loved one is forgetful, they probably just need to be there with them and help them, not as because you have dementia, we need to be with you. That's not how you go about it. Oh, so you want to go to the mall? I'd like to ride along with you, and just be there for support and guidance. One of the things that the driving, they get out on the road, they may forget that there's a stop sign. They may not recognize that it's a stop sign. They forget that it is. So you're looking at potential accidents. So it's a very touchy subject with at what point take the keys away, or how do you go about saying, it's just not safe for you to drive anymore. And I think you don't focus on the forgetfulness, you don't focus on the dementia, you don't focus on, let's see what's wrong with you, but focus on how to redirect it and say, well, I think I'd like to drive today if that's okay, and start looking for that and helping them. And then at some point, like we talked earlier, go to a specialist and start talking with the specialist about, let me explain to you what this disease can do and how this is going to affect you, and how can we make it easy for you and work through some of those, giving up some of those independence, which is the scary part of it. They don't want to give that independence picks up. So what can you do to help them to stay somewhat independent but yet safe? And that's where you start talking to some of your healthcare providers. What are the options? How can I do it? Adele is a wonderful contact person. The social worker, you know, at a hospice agency or the physician can help you with some of those processes and how can you help them keep safe. But I think it's not focusing on the negative, but helping them to redirect it to
It's
make
all about
it.
packaging it.
It
to
is.
make sure that you're still,
Right.
you know, providing that, you know, independence is still there,
It
but
is.
you're making sure that they're safe in the process. So before we go to the next break, Charlene, what can the family do once they realize that they've got a loved one who's been diagnosed? What can the family do? Because in the next part of the show, we're going to talk about how do we talk to our loved ones that are in this situation.
I think, as Patty said, not to be all about negative with the person, to be a positive there and be a support. And families need each other. You need to get the family together. We all need to be on the same sort of page of, you know, if you've got many sons, daughters, siblings, you've got to engage them. Because if you're an only child or the only person bearing this challenge, it can be very overwhelming for the caregiver. Especially if you don't know a lot about what's going on. So I would say the family is very key, or if you don't have family, friends, to be part of the caregiving process.
Absolutely. Well, and I think some of the takeaways here too is making sure that you're getting the proper treatment and the right diagnosis too. And coming up after the break, we're going to talk some more about dementia and how the family can really get involved with the conversation. And again, be positive. This is a very important time in our life, and we know how to handle this delicately. Stay with us. We'll be right back.
Hospice pays for the majority of medications that patients are on upon admission to hospice. We take care of medications from prescription from your doctor to the delivery of medications to your home. We take care of all of your needs with your prescription medications.
We at Embrace Hospice are not only dedicated to our patients and families, but to our veterans. A retired Army veteran with 27 years and my chief nursing officer with 20 years, a retired Army nurse. We believe that veterans deserve the care for what they did for our country at the end of their life.
Welcome back to Embracing Senior Health on WMBF News. One of the most frustrating parts of getting older is dementia and Alzheimer's. And it's not just frustrating for the patient, but it's also frustrating for the family. And that's what we really want to focus on this portion of the show. You know, we've talked about the dangers, we've talked about what is dementia, what is Alzheimer's, but now let's talk about the family and how they deal with this, because it can be very frustrating to look at your loved one that you've been married to for 30, 40 years, whatever it may be, and they don't remember who you are.
Yeah, and one of the things that I come across very often is that someone that's been remarried and they don't remember their second wife. They're now calling their second wife the first wife's name, and that is so, so difficult. But they're not trying to be mean and they're not trying to be hateful. That's all that they can remember. When you have Alzheimer's or a like dementia, you reverse in the opposite order that you went forward in life. And so you're going to forget your grandchildren before you can forget your children. You're going to forget your children before you forget your brothers and sisters. Most likely you'll never forget Mama and Daddy, because Mama and Daddy were always there. Mm-hmm. The one thing that I tell people that's very, very important is never ever argue with someone that has Alzheimer's or like dementia, unless they're going to hurt themselves or someone else. But live in their world, give them a purpose, and help them to live the best quality of life that they can. Because if you are not living in their world, oh my goodness, just makes things very difficult for the family and for that person.
It's important to keep those emotions in check too. It's easy to get frustrated and get angry.
And remember too that you're on their time and not your time. Because what you need to figure out is bath time. They don't like to take baths eventually. And did they take a bath? Did they take a shower? When did they do it? What was their routine? And then go with that, and don't make them fit into your mold, but find out what they liked, what was their mold, and you go with that. And the caregiver would be a lot better off. It'd be a lot easier to figure out that, especially like if they go to an assisted living facility. Some of them, at 8 o'clock in the morning, they have to have showers, they have to have bath. They didn't like it. They liked it in the evening, so figure that out and go with it. So go and redirect and go in their mold and not your mold, and not your time but their time. And I think that's important for a caregiver to remember as well.
And we were talking during the break too, Charlene, sometimes this is, these are small things that seem small right now, but they're not small in the future. Getting dressed, just getting ready for the day, these are things as the caregivers that we now have to think about.
And you forget, as Patty said, you forget, and you even forget how to eat. You forget how to chew. You forget how to swallow. You forget that you actually ate. And they come and say, you know, you didn't give me lunch. I want to eat again. And that is a big issue. And instead of arguing with them, you redirect them, maybe give them a little snack, and then 2 minutes later they may be back saying, well, how come you didn't feed me? Very frustrating for that caregiver, especially if it's in a home situation.
Well, what we want folks at home to know is that there is help. And you really should seek that help, because you're not alone and you shouldn't have to do it alone. Tell us a little bit about that.
There are lots of professionals out there that can help you. Social workers, someone like me that does consulting, goes into the home. When you go to the doctor and you take that person to the doctor, that doctor is not getting a true picture of who that person is. And I always want to have a true picture of who that person is. I never wear professional clothes. Whenever I go and do a consultation, I may wear jeans and a shirt. And I'm always a person that is a friend of one of the family members. Because the family members, we just go and we're doing a visit. I'm not asking them what day is it, what month is it, and all of those kinds of things. I'm just asking them everyday questions. We're just visiting. And that's how you get a true picture. There are lots of things that we need to prepare for, and you need to prepare for that before it's time to prepare. Because if you don't prepare for it and you're in panic mode, then it is very, very tough to have a healthcare power of attorney, a financial power of attorney. Who's going to be able to help mom and dad at these certain times?
Well, and that's what we're going to be talking about coming up after the break, is what we need to do to prepare, what are the things that need to be done. There's a checklist that we need to think about. So stay with us. Coming up after the break, we're going to take you through all the things that you need to do to prepare.
At Embrace Hospice, volunteers are the backbone of our care. If you feel that you could provide quality, compassionate care to one of our hospice patients, please call 1-855-OPEN-ARMS.
I'm encouraged that here at Embrace we have several competent, compassionate, spiritual care coordinators that come alongside the patients at the end of their life and help them in their spiritual journey.
Welcome back to Embracing Senior Health. We've been talking about Alzheimer's and dementia, and ladies, thank you so much again for joining us. And we really want to wrap up the show today with talking about planning. We all need to plan for the future. This is something that we don't see coming, so we need to plan for it right now. So how can we do that, Patty? What can we do?
Whether you have dementia, whether you have Alzheimer's, any type of diagnosis, it doesn't really matter. At 18 or older, when you start making those decisions about life, you need to think about what it is that you want. Particularly now, since we're talking about dementia, if you recognize that it's coming, before you get to the point that you're not oriented anymore, you need to go ahead and appoint someone to make healthcare decisions for you if you can't make them. So you can go ahead and have a part of making those decisions. How do you want your end of life to look like? Do you want life-sustaining procedures? Do you not? How do you want it to look, and who do you want to be in charge of that? At the very beginning of those stages, you need to go ahead and start making those decisions. The healthcare power of attorney, the financial power of attorney, because unless you have that, it's going to be difficult for anyone to be able to go and do financial business for you, or to to do what you want at the end of life, then what's going to happen is that your doctor is going to make those decisions for you. So it's important to go ahead and make those decisions. Contact an attorney. Go sit down with the attorney. Who do you want to make those decisions? And that way you can go ahead and have it planned out before it's too late. You don't want to have to go through the court system. That's financially taxing, and it's emotionally taxing for your family. So go ahead and make those plans now. Healthcare power of attorney, durable power of attorney. Make those decisions before it's too late.
And Adele, I think we're all guilty of this. We think about, we have time, I've got time, I'll get to it. Well, what happens if we don't get to it? I mean, I'm sure you've seen this a number of times.
Absolutely. If you don't have the time to go and do this, then you get into a panic mode and you don't know where to go. So you need to get those professionals in place now and not have it be in a panic mode where then you have to get it together then.
Yeah, and Charlene, what are some of our choices once we start to look long term? What do we need to think about?
Do you want to have any life-sustaining measures? Do you want to be put on a respirator? Do you want them to do CPR, cardiopulmonary resuscitation? What do you want at the end of life? Do you want people to remember you in a wonderful service, funeral service? Do you want to be buried? Do you want to be cremated? I mean, all these things. And it's not just because you have dementia, it's any stage of our lives, because at any given moment, something could happen to every one of us, and those things would be taken out of our hands. And we surely don't want that to be.
Absolutely, and just knowing what our options are in terms of assisted living and also hospice as well.
Right, and like Hattie said, the 5 Wishes, that's an excellent book that you can get online. In mine it says, I want my sons to pick me up and rock me, because I love to be rocked.
And that's a great thing. It's just those small things that are very important at the end of life. Ladies, thank you so much. Appreciate it. You're watching Embracing Senior Health. We have this show every Friday at noon right here on WMBF News, and we'll see you again next time. Thanks so much for joining us.